Good morning, all. So today we are going to discuss about anti-anginal drugs. We will discuss about the various types of the drugs used in the treatment of angina. So from this topic, students can learn about the introduction of angina, types of angina, pathophysiology of angina, and pharmacotherapy of angina. So first of all, let's discuss about angina pectoris. Angina pectoris, commonly known as angina, is severe chest pain due to ischemia. Ischemia is a lack of blood, hence a lack of oxygen supply. So the heart muscle, generally due to obstruction or spasm of the coronary arteries. Coronary arteries are the arteries which supplies the blood to the heart. It is caused by coronary blood flow that is insufficient to meet the oxygen demands of the myocardium, leading to ischemia. The imbalance between oxygen delivery and utilization may result during exertion from a spasm of the vascular smooth muscle or from obstruction of blood vessels caused by atherosclerotic lesions. These transit episodes, that is 15 seconds to 15 minutes of myocardial ischemia, do not cause cellular death, such as occurs in myocardial infarction. Options other than medications for treating angina include angioplasty and coronary artery bypass surgery. The imbalance between oxygen delivery and utilization may result during exertion from a span of the vascular smooth muscle or from obstruction of blood vessel caused by atherosclerotic lesions. These transient episodes of myocardial ischemia do not cause cellular death, such as occurs in myocardial infarction. Options rather than medications for treating angina include angioplasty and coronary artery bypass surgery. A major risk factor for angina pectoris are age, cigarette smoking, diabetes mellitus, dyslipidemia, family history, hypertension, kidney disease, obesity, physical inactivity, and medications. A type of angina first is stable angina. A stable angina is the most common form of angina and therefore is called typical angina pectoris. It is characterized by a burning, heavy, or squeezing feeling in the chest. It is caused by the reduction of coronary perfusion due to a fixed obstruction produced by coronary atherosclerosis. The heart becomes vulnerable to ischemia whenever there is increased demand, such as that produced by physical activity, emotional excitement, or any other cause of increased cardiac workload. A typical angina pectoris is promptly relieved by rest or nitroglycerin, that is a vasodilator. Unstable angina. Unstable angina lies between stable angina or the one hand and myocardial infarction on the other hand. In unstable angina, chest pain occurs with increased frequency and are precipitated by progressively less effort. The symptoms are not relieved, but rest or nitroglycerin. Unstable angina requires hospital admission and more aggressive therapy to prevent death and progression to myocardial infarction. Third type of angina are the Prinzmetal's of variant or vasospastic angina. Prinzmetal's angina is an uncommon pattern of episodic angina that occurs at rest and is due to coronary artery spasm. Symptoms are caused by decreased blood flow to the heart muscle due to spasm of the coronary artery, although individuals with this form of angina may have significant coronary atherosclerosis. The angina attacks are unrelated to physical activity, heart rate, or blood pressure. Prinzmetal's angina generally responds promptly to coronary vasodilators such as nitroglycerin and calcium channel blockers. Next is mixed form of angina. Patients with advanced coronary artery disease may present with angina episodes during effort as well as at rest, suggesting the presence of a fixed obstruction associated with endothelial dysfunction. Treatment drug classifications. Three classes of drugs used either alone or in combination are effective in treating patients with angina. These agents lower the oxygen demand of the heart by affecting blood pressure, venous rhythm, heart rate, and contractility. So the classification of anti-anginal drugs are organic nitrate. Examples are isosorbide dinitrate, isosorbide mononitrate, and nitroglycerin. Second class of drugs are beta blockers. Examples acebutolol, atenolol, metoprolol, and propranolol. Third class of the drug, that is calcium channel blockers. Example amlodipine, diltiazem, felodipine, nicardipine, nifedipine, and verapamil. Drugs used to relieve or prevent the symptoms of angina. Nitrates, beta blockers, calcium antagonists, potassium channel activators. As the fundamental cause of angina pectoris is insufficient oxygen supply to heart muscle, it is logical to attempt to increase the oxygen supply by administering oxygen, that is, by increasing the inspired oxygen concentration. Similarly, patients with angina may suffer from severe pain and pain relief with a potent opiate. Morphine needs to be considered to make the patient more comfortable, less anxious. Nitrates mode of action acts directly on vascular smooth muscle to produce arterial and venous dilation. Effect during angina reduces myocardial oxygen demand, that is lowers preload and afterload, increase myocardial oxygen supply, that is coronary vasodilation. Nitrate preparations such as sublingual glyceryl trinitrate, buccal glyceryl trinitrate, transdermal glyceryl trinitrate, oral isosorbide dinitrate, oral isosorbide mononitrate, intravenous sublingual glyceryl trinitrate for acute myocardial infarction or left ventricular failure, that is, the dose is from 10 to 200 microgram, or minimum intravenous infusion titrating to clinical response and blood pressure. Here we can see the duration of action of some nitrate preparations, such as first nitrate preparation, that is sublingual glyceryl trinitrate, in a tablet form 300 to the 500 microgram, or metered dose aerosol form, that is 400 microgram per spray. The peak action would be in 4 to 8 minutes, and the duration of action is 10 to 30 minutes. Second preparation, that is a buccal glyceryl trinitrate, uh, 1 to 5 mg tablet, 6 hourly, peak action 4 to 10 minutes, and duration of action 30 to 300 minutes. Transdermal glyceryl trinitrate, dose is 5 to 10 mg daily, peak action within 1 to 3 hours, and the duration action is up to 24 hours. Oral isosorbide dinitrate, dose is 10 to 20 mg 8 hourly, peak action 45 to 120 hours, duration of action is 2 to 6 hours. Oral isosorbide mononitrate, that is dose is 20 to 60 mg once or twice a day, peak action 45 to 120 hours, and duration of action is 6 to 10 hours. Sublingual glyceryl trinitrate administered as a tablet 300 to 500 microgram to dissolve under the tongue, as metered dose aerosol 400 microgram per spray. It relieves an attack of angina in 2 to 3 minutes. The unwanted effect of this drug is headache, symptomatic hypotension, that is dizziness, postural giddiness, blurring of vision, and rarely syncope, that is fainting. Ask patient to split tablet if above effects occurs, not habit forming. Teach patients to use prophylactically, that is before exerting. Virtually ineffective if swallowed due to extensive first pass metabolism in the liver. Continuous use causes pharmacological tolerance. Therefore, attempt to include a nitrate-free period of 6 to 8 hours a day. Beta blockers mode of action lowers myocardial oxygen demand by reducing heart rate, reducing blood pressure, reducing myocardial contractility, can exacerbate symptoms of peripheral vascular disease, may provoke bronchospasm in patients with obstructive airway disease such as asthma. Theoretically, non-selective beta blockers may aggravate coronary vasospasm by blocking the coronary artery beta 2 receptors. Advice: use a once daily cardioselective preparation, that is atenolol 50 to 200 mg daily, slow release metoprolol 50 to 200 mg daily, bisoprolol 5 to 10 mg daily. Beta blockers should not be withdrawn abruptly because of the possibility of a rebound effect and the risk of precipitating arrhythmias, worsening angina, or causing myocardial infarction. That is the beta blockers withdrawal symptoms. Calcium antagonist mode of action decreases myocardial oxygen demand by reducing blood pressure and myocardial contractility. Types: hydropyridine calcium antagonist. Example are nifedipine, nicardipine, often cause reflex tachycardia, best used in combination with beta blocker, not used or caution when using verapamil and diltiazem, suitable for patients who are not receiving beta blockers as they decrease the heart rate. Calcium channel antagonists may reduce myocardial contractility to a degree that can aggravate or precipitate heart failure. Unwanted effects: peripheral edema, flushing, headache, and dizziness. Potassium channel activators mode of action: dilate arteries and veins, does not exhibit tolerance seen with nitrates. Nicrodil 10 to 30 mg 12 hourly. Caution in hypovolemic patients, patients with pulmonary edema. Side effects: headache, flushing, dizziness, weakness, may cause a dose-dependent increase in heart rate, myalgia, and angioedema. Antiplatelet drugs, that is, aspirin, clopidogrel. Thrombolytic agent, that is, streptokinase, alteplase, retiplase. Aspirin, antiplatelet effect by inhibition of thromboxane A2. NSAID inhibit COX-1 and COX-2, which leads to decreased prostaglandin synthesis. Uses thromboembolic CVA, ischemic heart disease prophylaxis, that is 75 mg per day, and acute treatment. Contraindications: those under age of 16 year can increase incidence of Reye's syndromes, liver and brain damage, gastrointestinal ulcers, bleeding disorders, gout, hypersensitivity to any NSAID, and glomerular filtration rate less than 10 ml per minute. Cautions during taking the aspirin administration are: during asthma, uncontrolled hypertension, any allergic diseases, G6PD deficiency, dehydration. Ototoxicity in overdose may increase effects of sulfonylurea and of methotrexate for analgesia. 900, 300 to 900 mg 4 to 6 hourly. Maximum dose 4 gram per day. Stop 7 days before surgery if significant bleeding is expected. If cardiac surgery or patient has acute coronary syndrome, consider continuing. Clopidogrel, antiplatelet agent, ADP receptor antagonist, uses prophylaxis of antithrombotic events in non-ST elevation myocardial infarction and in ST elevation myocardial infarction in combination with aspirin. Myocardial infarction within a few to 35 days, ischemic cerebrovascular accident within 7 days to 6 months, peripheral arterial disease, contraindication, active bleeding. It is not recommended with warfarin. Clopidogrel side effects, hemorrhage, especially gastrointestinal or intracranial, gastrointestinal upset, peptic ulcer, pancreatitis, headache, fatigue, dizziness, paresthesia, rash or pruritus. Monitor full blood and for signs of occult bleeding. Streptokinase, thrombolytic agent, increases plasmagen conversion to plasmin, which increases fibrin breakdown, uses acute myocardial infarction 1.5 million units intravenous infusion over 60 minutes, thromboembolism of artery, pulmonary embolism, central retinal artery thrombosis, deep vein thrombosis. Other doses 250,000 units intravenous infusion over 30 minutes, then 100,000 units every hour for up to 12 to 72 hours. Atiplase, recombinant tissue type plasminogen activator, recombinant fibrinolytic, use acute myocardial infarction, total dose 100 mg, regimen depends on time since onset of pain 0 to 6 hours, 15 mg intravenous bolus followed by 50 mg intravenous infusion over 30 minutes and 35 mg intravenous infusion over 60 minutes. 6 to 12 hours, 10 mg intravenous bolus followed by 50 mg intravenous infusion over 60 minutes and 4 further 10 mg intravenous infusion each over 60 minutes. Decrease dose if patients weigh less than 65 kg. Retiplase, recombinant plasminogen activator, thrombolytic, used only for myocardial infarction, dose 10 units as slow intravenous injection over 2 minutes. Repeat after 30 minutes. Now come on the quiz. First question, angina pectoris is four options are first, severe constricting chest pain, often radiating from the precordium to the left shoulder and the down arm due to insufficient blood supply to the heart, that is usually caused by coronary artery. Option B, an often fatal form of arrhythmia characterized by irregular fibrillar twitching of the ventricles of the heart instead of normal contractions, resulting in a loss of pulse. Third option, the cardiovascular condition in which the heart ability to pump blood weakness. And the fourth option, all of the above. The correct answer is A, that is severe constricting chest pain, often radiating from the precordium to the left shoulder and down the arm due to insufficient blood supply to the heart, that is usually caused by coronary disease. Number two, all these drug groups usually in angina both decrease myocardial oxygen requirement by decreasing the determinations of oxygen demand and increase myocardial oxygen delivery by reversing coronary artery spasm, except out of four options, first option nitrate and nitrite drugs, that is nitroglycerin isosorbide dinitrite. B. Calcium channel blocker such as nifedipine, nimodipine. C. Beta adenoreceptor blocking drugs such as atenolol, metoprolol. And D. Potassium channel opener such as minoxidil. So the correct answer is C, that is beta adenoreceptor blocking drugs, that is atenolol and metoprolol. Third quiz, this drug group usually in angina decrease myocardial oxygen requirement by decreasing the determination of oxygen demand and does not increase myocardial oxygen delivery by reversing coronary artery spasm. Options are A. Nitrite or dinitrite drugs, that is nitroglycerin isosorbide dinitrate. B. Myotropic coronary dilators, that is dipyridamolol. C. Potassium channel opener, that is minoxidil. And D. Beta adenoreceptor blocking drugs, that is atenolol and metoprolol. Correct answer again, beta adenoreceptors blocking drugs, that is atenolol and metoprolol. Next, These drug group useful in angina increase myocardial oxygen delivery by reversing coronary artery spasm and does not decrease myocardial oxygen requirement by decreasing the determinants of oxygen demand. Options are A. Beta adenoreceptor blocking drugs such as atenolol and metoprolol. B. Myotropic coronary dilators such as dipyridamole. C. Calcium channel blockers, that is nifedipine and nimodipine. And the D options, a potassium channel minoxidil, that is minoxidil. So the correct answer is B. Myotropic coronary dilators.
Hello everyone, myself Miss Niti Suryan, Assistant Professor at SWIG.
Which of the following statements concerning nitrate mechanism of action is true? Option A. Theoretically active agents in this group are capable of releasing nitric oxide into vascular smooth muscles, targeting tissues. B. Nitric oxide is an effective activator of soluble guanylyl cyclase and probably acts mainly through this mechanism. C. Nitrates usually useful in angina decrease myocardial oxygen requirement by decreasing the determinants of oxygen demand and increase myocardial oxygen delivery by reversing coronary artery spasm. And D option are all of the above. So the all of the above is correct. Which of the following nitrates and nitrite drugs are long acting? A. Nitroglycerin sublingual. B. Isosorbide dinitrate sublingual. Isos- Isorodil or sorbitrate. C. Amyl nitrate inhalants, that is aspirols and vaporil. And D. Sustac. So Sustac is correct. Quiz 7. Which of the following nitrates and nitrite drug is a short-acting drug? Option nitroglycerin, 2% ointment, nitroglycerin, oral sustained release, amyl nitrate, inhalants, and sustac. So the correct answer is amyl nitrate, third option. Quiz 8. Which of the following nitrates and nitrite drug is used to prevent for the prevention of angina attack? A. Nitroglycerin, 2% ointment, nitroglycerin, oral sustained release, and isosorbide mononitrate, and option D, all of the above. So the all of the above is correct. 9. Duration of nitroglycerin action is A. 10 to 30 minutes, B. 6 to 8 hours, C. 3 to 5 minutes, and D. 1.5 to 2 hours. So the correct answer is 10 to 30 minutes. Question 10. The following statements concerning mechanism of nitrate beneficial clinical trial effects are true except option A. Decreased myocardial oxygen requirement. B. Relief of coronary artery spasm. C. Improved perfusion to ischemic myocardium. D. Increased myocardial oxygen consumption. So the correct answer is increased myocardial oxygen consumptions. 11 question. Side effects of nitrates and nitrite drugs are accept A. orthostatic hypotension, that is tachycardia, B, GI disturbance, C, throbbing headache, and D, tolerance. So the correct answer is GI disturbance. And these are the references for this chapter. Thanks a lot.